holding the HSJ HealthSHIFT Access and Empowerment event because it's a really important time in the development of care closer to home agenda. Neighbourhood health is at the top of a lot of people's thoughts. People are out in the service really struggling to get clarity about what it means and how to take it forward. And so the event is an important opportunity to get some of that clarity and to hear what some of the outstanding examples are doing. It is clearly allied really importantly to health inequalities. If you're going to improve outcomes and services closer to home for populations that are most in need of improving their health, then you have to be thinking about health inequalities. The centre of the NHS is really struggling with that at the moment. There's not a great amount of focus on health inequalities, so we're really pleased that HSJ HealthSHIFT is able to help with that.
Bringing different agencies together from across health and social care, local authority, government is a really important way for us to start to recognise the challenges that we're each operating in. Neighbourhood health requires all of us to come together in partnership, but we can't do that unless we understand each other's context and challenges and also the benefits that we bring from each other and working together.
We need some pragmatism in terms of the way we lead and the decisions we make. We've got challenges today that the public expect us to get on with, and that's supporting in general practice access, supporting those who are most frail, but then we've got to be moving towards a more demedicalised, holistic model of care that really engages the whole person, so that actually we start to make a difference to the root cause of issues and don't just treat the symptoms.
I think the most meaningful and arguably long-term shift we need to see is from treatment to prevention. That's where the improvements are going to be for our communities, and if you think about the ageing population we have, that's where we need to invest for the future.
For me, the biggest shift we need is a cultural shift in our workforce, more undergraduate training and placements in community sectors. So I want to see less students in hospitals and more of them in their undergraduate training having clinical exposure in the community during their training.
When I look at the three shifts, I think that sickness to prevention, acute to community, but the third one, analog to digital, is the one that will facilitate those changes. Just digitalising current processes will change nothing. We need to think in a completely different way. How would that occur if we were to think about things that are digitally enabled in the first place? So really important facilitator, but the acute to community transformation is the one that's most important and will have the most long-lasting impact on the population of England.
It's becoming much more incumbent upon digital leaders to make sure they are taking on board not only patient voice but patient experience, especially when looking at how we're going to be designing digital interventions for patients in order to actually really impact population health outcomes and to affect real change. We need to be making products that are so much easier to use for our patients to be able to engage with.
The HSJ events are thought-provoking and interesting. It's a good platform for networking and connecting senior people with experience.
The real value in them is the diversity of thought, the diversity of the delegates that are here.
I come here just to meet and greet, learn from others and take it back.